I'm Rhea from Active Health Clinic, and today I wanted to speak to you about PEM, or Post-Exertional Malaise. Now, this is something that's unique to chronic fatigue syndrome, and this is probably one of the most suckiest of symptoms reported across the board, and I know it was one of the things that I had the most issue with during my experience. So basically, post-exertional malaise is exactly what it sounds like. You feel crappy after doing something. But this is something that you might feel crappy after physical activity, in terms of, going to the supermarket, but it's also something that can come from mental load, either cognitive or emotional, and it can also come from environmental load too, which can be the things around you, people, places, things that you can hear, see, smell, taste, touch, all of those sort of things. So it's actually really important to identify when you're experiencing post-exertional malaise and the why behind it, because that helps us understand where some of our symptoms are coming from. Now, I was actually in a cycle of post-exertional malaise for 4 straight years. I decided what my body could do and I pushed it through. And post-exertional malaise is probably one of the most terrifying symptoms that I went through, because you get to the point that your body just doesn't work. It is pain, it is sore, it is heavy, and lifting up a finger is it's hard, and being so young and going through that, it's really quite uncomfortable, and I know most of you watching this will really identify with that. And why I bring that up is because it's important that we also communicate that to those around us. It's not that we say no because we're lazy, it's sometimes that we say no because it's productive for our health, or because we know what it means at the end of it, that we might look fine whilst we're doing it, but the payback could be a few days or even sometimes a few weeks. So it's really important that you do identify your post-exertional malaise triggers so that you put supportive strategies in place. And this is the number one principle of pacing. And as we know, pacing is the most productive thing for CFS and associated conditions, because you actually can't force your body to do above its capacity, because it's quite dangerous, as we've felt. So it's really important that we communicate this to others so that we're not overloading ourselves, but also others aren't overloading us also. And it's just more about identifying where our needs are so that we work within them. So I invite you today to take post-exertional malaise seriously. It is something that you need to listen to. It is something that you need to work alongside. And the more you do, then the more you'll be able to do. That's the really tricky thing, is we feel like we need to pull back and not do anything, and which isn't productive. But the more we work with our body, then the more our body works with us, and we're able to find a balance, and that balance is key. So if you need help with this, you need to speak to your medical professional team. That might be your GP, your exercise physiologist, or speaking to other people who have experienced this symptom, because it can be quite scary. You do need to talk about it, and you do need strategies alongside. So I do invite you to join our Active Health Clinic Wellness Tribe. This is a space where like-minded people dealing with very similar illnesses may be able to give you some advice or support, or just remind you that things do get better when you are experiencing a pretty crappy day. So I hope to see you soon in the tribe, and I hope you don't enjoy any more or disenjoy any more post-exertional malaise.